Preparedness Plan for Bioterrorism in the District Health Office. Bioterrorism poses a significant threat to public health and safety, requiring a comprehensive preparedness plan to mitigate its impact. The District Health Office plays a critical role in developing and implementing such a plan, ensuring that the community, healthcare facilities, and stakeholders are equipped to respond effectively. The preparedness plan is based on a multifaceted approach, focusing on prevention, detection, response, and recovery. 1. Risk assessment and prevention. Risk identification. Conduct assessments to identify potential biological agents that could be used in a bioterrorism attack, e.g., anthrax, smallpox, plague. Evaluate vulnerabilities in the district, such as high-density areas, critical infrastructure, or events that might attract large gatherings. Community awareness. Educate the public and local organizations about bioterrorism threats, symptoms of common biological agents, and the importance of reporting unusual health patterns. Collaboration with law enforcement. Establish partnerships with police, intelligence agencies, and border control to monitor and prevent unauthorized access to biological agents. 2. Surveillance and early detection. Epidemiological surveillance. Implement a robust disease surveillance system to monitor unusual patterns of illness in the community, such as clusters of unexplained fevers or respiratory symptoms. Healthcare provider training. Train local healthcare workers to recognize signs of exposure to biological agents and report suspected cases promptly. Diagnostic capabilities. Equip laboratories with the capacity to test for priority biological agents and ensure rapid communication of results. 3. Response Plan Incident Command System, ICS. Establish a district-level incident command system to coordinate the response to a bioterrorism event. Clearly define roles and responsibilities for health officers, emergency responders, law enforcement, and community leaders. Mass prophylaxis and vaccination plans. Develop protocols for the rapid distribution of antibiotics, antivirals, and vaccines to affected populations. Pre-identify mass vaccination sites and train staff for efficient operations. Isolation and quarantine. Prepare to isolate infected individuals and quarantine exposed populations to limit disease spread. Healthcare surge capacity. Ensure hospitals and clinics are equipped to handle a sudden influx of patients. Stockpile necessary medical supplies, PPE, and ventilators. 4. Public communication and information management. Risk communication. Develop a communication strategy to provide accurate, timely information to the public, reduce panic, and promote compliance with public health measures. Rumor management. Monitor social media and other channels for misinformation and address it promptly to maintain public trust. Multi-language messaging. Provide information in multiple languages to reach all community members, including migrants and non-native speakers. 5. Training and drills. Simulation exercises. Conduct regular bioterrorism response drills to test the district's preparedness and improve coordination among stakeholders. Healthcare training. Provide ongoing education to healthcare providers on recognizing and managing bioterrorism-related illnesses. Community involvement. Engage local organizations, schools, and volunteers in preparedness activities to build resilience. 6. Recovery and evaluation. Medical and psychological support. Ensure long-term medical care and mental health support for survivors and responders affected by the event. Environmental decontamination. Plan for the safe and thorough decontamination of affected areas to restore community trust and functionality. After-action review. Conduct a review of the response to identify strengths, weaknesses, and areas for improvement. Update the preparedness plan accordingly. 7. Resource mobilization and funding stockpiles. Maintain an inventory of essential supplies, including antibiotics, vaccines, PPE, and decontamination equipment. Funding. Secure funding through government grants and partnerships to sustain bioterrorism preparedness programs.